Hello everyone. Today, we're exploring the medication known as Raloxifene, commonly marketed under the brand name Evista. As always, this discussion is for educational purposes only. If you have any health-related questions or concerns, it's important to consult with a healthcare professional. Description: Raloxifene, sold under the brand name Evista, is an oral tablet that belongs to a class of drugs known as selective estrogen receptor modulators, SERMs. It mimics the effects of estrogen on certain parts of the body, such as the bones, while blocking estrogen effects on other parts, like the breasts and uterus. Approved by the FDA in 1997, Evista is primarily prescribed to prevent and treat osteoporosis in postmenopausal women, helping to reduce the risk of vertebral fractures. Additionally, it is used to reduce the risk of invasive breast cancer in postmenopausal women with osteoporosis or at high risk for breast cancer. Raloxifene works by increasing bone density and altering the cycle of bone formation and breakdown in the body. Warnings: Raloxifene is not suitable for everyone. It should not be taken by women who are pregnant or may become pregnant, as it could harm the fetus. Additionally, individuals with a history of blood clots, including deep vein thrombosis, pulmonary embolism, and retinal vein thrombosis, should avoid this medication due to the increased risk of developing blood clots. It's also not recommended for individuals with liver disease or those allergic to any components of the drug. Before taking this medicine. Before starting Raloxifene, discuss your medical history with your healthcare provider, especially if you have a history of liver disease, heart disease, high triglycerides, due to estrogen treatment, or if you're prone to prolonged periods of immobility, such as long flights or bed rest. It's also important to inform your doctor if you smoke or have a history of high blood pressure, kidney disease, or heart failure. Women who are pregnant, planning to become pregnant, or breastfeeding should not take Evista. Side effects: Common side effects of Raloxifene include hot flashes, leg cramps, swelling of the legs and feet, flu symptoms, joint pain, and sweating. Although less common, more serious side effects can occur, such as blood clots and stroke. Immediate medical attention is required if you experience symptoms such as unexplained leg pain, chest pain, sudden shortness of breath, or changes in vision. Additionally, rare but severe side effects like liver problems and increased triglyceride levels can occur. Interactions: Raloxifene may interact with other medications, including blood thinners, anticoagulants, cholestyramine, and estrogens. Inform your doctor about all medications, supplements, and herbal products you're taking to prevent potential interactions. Dosage: The dosage of Evista is typically 60 mg taken once daily, with or without food. It's crucial to follow your doctor's instructions closely and not to adjust the dose without consulting them. Regular monitoring, including bone density tests and breast exams, is recommended to assess the drug's effectiveness and detect any adverse effects. Avoid: While taking Raloxifene, it's advisable to avoid situations that can lead to prolonged immobility, such as long-distance travel, where you're unable to move around regularly. Staying active can help reduce the risk of blood clots. Additionally, due to the risk of liver problems, it may be wise to limit alcohol consumption. FAQ: Many people inquire about the use of Evista in men. Currently, its safety and effectiveness in men are not well established. For specific questions or concerns about Raloxifene and its use, consulting a healthcare provider is always recommended. Closing: That concludes our overview of Raloxifene, also known as Evista. Remember, this information is intended for educational purposes and should not substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.